Welcome everyone. This is my personal YouTube page. This is Dr.Pritam Chatterjee's page. Dr.Pritam Chatterjee is myself. I have passed BDS from Rajiv Gandhi University of Health Sciences, Bangalore. At present, I am a postgraduate trainee in the Department of Public Health Dentistry in Navodaya Medical College and Hospital. Today, I will be discussing regarding COVID-19 and its effect on our oral and dental health. Because in this COVID, after having so much of steroids and even the antiviral medicines, we have seen that the oral health is degrading. And the most best example which all of us saw was the black fungus. It was affecting our oral cavity a lot. So the COVID-19 and its effect on oral health is very, very important. Being a dentist, being a health professional, being a normal general citizen, whoever cares about his or overall oral health, because oral health is a very, very important part of general health. So you have to know about your general health, so you have to know about your oral health. So let's start. Coming to the first thing, what is this COVID-19? COVID-19, as we all know, was a pandemic which was started in the year 2019. It was started, but the first case came in the Wuhan city of China in the November 2019. Actually, this is the coronavirus is not the first time which is attacking the world. This time it became a pandemic. Before this, they were epidemics with a smaller scale of affecting people, or smaller. If you see, the amount of people affected were less. The population which affected was less. In this, the population which got affected was much, much more, or rather we should say it's a worldwide. If you see, it has two predecessors. The first was in the year 2003, known as SARS, the subacute respiratory syndrome, and the second one was MERS, MERS, which is Mediterranean respiratory syndrome, in the year 2012. Coming to how the virus looks, if you see this picture, you can clearly see the virus looks something like this. See, normally viruses are two types. If you see a virus, it can be an RNA or a DNA virus. This is an RNA virus which consists of the nucleocapsid, the spike glycoproteins, the hemagglutinin, membrane glycoprotein, and small evidence of glycoprotein even is present on the cell wall. If you see this, the spike glycoproteins are mainly of two types, the S1 and S2. The main mode of transmission of this virus, as we all know, is the oropharyngeal or the nasopharyngeal, mainly through the nose and the mouth. It goes and it sits. If you see this picture, you can easily understand it will go and combine with the S protein. S protein of what? The ACE2. The SE2, it gets attached, and from there it goes into the liver, and from there it directly goes into your blood, which may causes ageusia, anosmia, hyposalivation, oral ulcers, gingivitis. These are oral manifestations. We will be later on speaking about your general complications and general symptoms that we mostly see in case of a COVID-19 cases. If you see the stages of affecting, the stage of affecting of COVID-19 was mainly classified into three stages: stage 1, stage 2, and stage 3. Stage 1 is asymptomatic state. Actually, in asymptomatic stage, what happens is the contamination of the infection with viral clearance is about 80% of the patients is 10 to 14 days. In stage 2, you will see only the upper airway and the conducting airway response. And the third one is the stage 3, in which we see the hypoxia, ground glass infiltrates will be present in our x-rays, and the progression to the ARDS, acute respiratory distress syndrome, where we will have a severe breathlessness. If you see the stages, the first stage is the binding of the inhaled SARS-CoV-2 to the ciliated secretory cells in the nasal epithelium via ACE2. The viral replications and local propagation with the limited immune response. Contamination of the infection with the viral clearance is about 80% of the patients in 10 to 14 days. Involvement of the conducting airways, upper respiratory tract, and migration into the lower respiratory tract. This mainly happens with the help of the ACE2 that are present in the pulmonary alveolar epithelial cells. From there, we will see the cytokine storm, the viral replications, and at the end of the day, it will cause the diffuse alveolar damage, which results into the acute respiratory distress syndrome. Coming to the very important, the incidence rate of COVID-19. By the way, let me tell you that what is the full form of this COVID? Many people, I think, that they don't even know what is the full form of COVID. The COVID is coronavirus disease of 2019. That is the full form of COVID-19. And this COVID-19 got its the WHO classified it as a public health emergency of international concern on Jan 30, 2020, and it was declared as a pandemic on 11th March 2020 by WHO, the World Health Organization. Let's see, these are some of the statistics that have been received from the World Health Organization. Total cases all over the world is 21.4 crores and total deaths is 44.6 lakhs. As of 1st of May 2021, the new cases were 8,70,405 one day report with a 7 days average of 8,24,715. If you see the statistics, you can understand that it was slowly increasing. It goes to a peak and goes down. This is the normal scenario of how corona is affecting in day-to-day life. In the case of the deaths, if you see, as of 22nd January 2021, the deaths were of a one-day report was 16,495 and 7-day average was 13,793. This is the worldwide scenario. Coming to the Indian scenario, the first case in India was reported in Kerala 30th January 2020 and the first death was reported in 12th March 2020 for a 76-year-old male in Kalburgi, is a district of Karnataka. If you see the graph, you will see that there are two peaks. The first wave peak is pretty much down and the second wave peak is pretty much high. Total cases as of 7th May was, August, it was 3.25 crores and total deaths was 4.36 lakhs. On 7th May had the highest cases till now. One day average highest case in India was on 7th May, having 4,01,078 cases, and the highest death as of now in India was on 21st May, 4,194 deaths in one day. Next, coming to the clinical manifestations. What are the symptoms? What do we see in a patient which comes with in daily-to-day practice? We see hundreds of cases coming up in COVID-19. So what are the things that we see? If you see this, that COVID-19 patients are normally we classify or we divide into three subgroups: mild cases, moderate cases and severe cases. Mild cases will have fever, symptoms of upper respiratory tract infections like cough, cold, loss of taste sensations, and the partial pressure of oxygen, that is the oxygen level present in our blood, will be 97% on the room air. In moderate cases, which are little severe than mild but much less severe than the highest form of cases, the symptoms of the pneumonia, all the pneumonia symptoms will be present, with respiratory rate will be more than 24 per minute. The partial pressure of oxygen, that is the oxygen level present in the blood, will be less than 94% in the room air. The severe most cases is the respiratory distress requiring mechanical ventilation. It can be invasive or non-invasive. That will be detailed and much details will be given in the next video. The SpO2, which is the partial pressure of oxygen, will be less than 90% in the room air. If you see the percentage of the symptoms seen in the patients, 70% will, according to one of the journals in the which was research conducted in Japan. If you see, 70% of the cases will have fever, shortness of breath. Only fever is seen in 43%, cough will be seen in 50%, myalgia will be 36%, runny nose in 6%, sore throat 20%, headache 34%, nausea and vomiting 12%, abdominal pain and diarrhea in 19%, a loss of smell and taste will be seen in 8% of the patients. The testing. Coming to the testing is RT-PCR. The full form of RT-PCR is real-time polymerized chain reaction. If you've seen, these are some of the steps how the testing is done. The first is when we take a nasopharyngeal or the oropharyngeal swab, which is taken either from your nose or from your oropharyngeal cavity. Next, we will do the sample collection and storage has to be done. Next is viral deactivation with RNA extraction. The RNA of the virus from the virus nucleotide will be extracted. Then it will undergo the retrotranscription. These are some of the genetic procedures, and then it will undergo the PCR. What is the full form of PCR? Is polymerized chain reaction. Okay, in this we amplify the virus to see the RNA coding. Coming to the next, the risk management planning according to the Indian our Ministry of Health and Family Welfare. If you see, these are the different type of risk management prescribed for all our health professionals. The first one is, if it is a moderate case, it's a mild case, best is go for home isolation. Contact precautions has to be taken. Symptomatic management, we can give HCQs, we can give paracetamols, we can reduce the fever. Explanation of the danger signs like breathlessness that can happen to the patients. So home isolation with proper care by the health professionals is enough in case of the mild cases. At all, if the case it's not curing for more than 14 days, then we can go for some medical consultations and we can get admitted in the hospital. Next, coming for the moderate cases, the hospital admission has to be done, where the ECG has to be taken care, HCQs has to be given, oxygen therapy has to be given with the help of the HFNO or non-invasive ventilation we can give. The IV methylprednisolone has to be given, which is a steroid. The prophylaxis with the LMHW, that is the enoxaparin, which will reduce your blood clotting, and the CBC with absolute lymphocyte count, and all the D-dimer test, the CRP levels has to be checked every 72 hours. Coming to the hospital admission has to be, which is mandatory in the severe cases. In this, oxygen therapy has to be started as soon as possible. The HFNO, the NIV, the non-invasive ventilation, ICU has to be provided to the patients. It will take care that the patient doesn't undergo sepsis or fluid accumulation in the upper respiratory tracts. In this, the antiviral remdesivir at 200 mg IV has to be started. IV methylprednisolone has to be started, and ARDS management has to be started. Coming to the oral manifestations, the oral health manifestations. In this case, you will see the tongue is affected in 38% cases of COVID-19. The labial, the cheek is affected in 26% of the cases. The palate is affected in 22% of the cases. Gingiva is affected in 8% of the cases. Buccal mucosa in 5% of the cases. The pharynx is in 4% of the tonsil in 1% of the cases. This is according to research done by Emilia et al. It's a review article by Emilia et al. These are some of the cases where you will see the common oral health lesions. You will see aphthous ulcer-like lesions. Aphthous ulcers are something which we have during when we are in stress. We get some types of lesions. If you see this photograph, you will understand the white plaque with a reddened border. These are aphthous ulcers which you will see. Red and white plaques which will be present on the tongue. They are not scrapable. To be very frank, they might be or might not be scrapable. Then you can see the herpetiform ulcers or zoster-form lesions in your labial mucosa that will be reddened. They will not have that white plaque in between, as in case of the aphthous ulcers. It will be completely reddened, what you see in this picture. Coming next, you can see the erythema multiforme like lesions. It will be a complete lesions with white plaques in between. It will not be localized, it will be somewhat generalized in the labial mucosa. Next, necrotizing ulcerative gingivitis, where you will see the complete gingival swelling with lot of pus discharge may be there, and bleeding will be there from the gingiva. And next is Merkel cell rosal dystonia, where you will be seeing the fissures present on the tongue. These are some of the case reports by Dr. Aravindan Karunakaran. He described that he saw some of the cases of post-COVID recovered patients. He saw that the heart palate showing erosive lesions in COVID-19 female patients. You see the heart palate will have some lesions like this. The generalized erythema or the petechia, the general erythema, the red dots will be present in the palate. It is a positive COVID-19 positive male. These are two more cases where you will see the mandibular posterior lesion gingival area. Lesions will be present in the palate, particularly the red spots. These are some of the cases that have been reported by Dr. Aravindan Karunikaran in some of his case studies. Now let's come to the prevention strategy, which is still after so many days, still people are not following. Still we are seeing people on the road without masks, without sanitizers. They are like, okay, it has come, it will go. I understand we are socially, economically, we are shattered. In some cases the families are shattered because of the untimely deaths. But make sure all of us, may it be a health worker, may it be anyone, but prevention strategies are very, very important. We have to keep 1 meter distance, masking, no crowding, hand washing. All these are very, 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 very important. Now, vaccination. Now, this vaccination has become like a taboo. I don't want to mention like that, but there are certain group of people who are telling vaccination should not be taken, vaccination has a problem, and there are hundreds of taboos and stories going behind vaccination. But believe me, entire world, all medical fraternities, everybody has proved that vaccination is reducing the intensity of COVID-19 virus. So please, it's a request to each and every citizen of the country and the world to please take the vaccine, not to protect yourself only, but to protect the society as a whole. If you stop getting infected, the 10 people who could have got infected from you will also not get infected. So please everybody gets a vaccine done. This is some of the scenarios I am showing you on 24th of August. They are the global scenario of getting vaccination, and this is the Indian scenario. You can see the graphs, how well planned vaccination drive is going on in the entire country. Coming to the COVID-19, the next thing which I want to show you all is something which is everybody is finding very difficult and finding very dangerous, is mucormycosis, the black fungus. Yes, black fungus is another threat which COVID has given us. It's nothing to be worried about. Black fungus is not something which has come up all of a sudden. It was there. But because of taking of excessive steroids and because of excessive hospitalization and taking the nebulizers and oxygen therapy, our oral cavity is becoming humid, our immune responses are going low. Because of this mucormycosis is an opportunistic organism which is present, which is infecting the human beings. Okay, so let's come to what is the incidence of black fungus. If you see, the black fungus is in India, total cases as of now in India is 45,432. Receiving treatment is 21,085, and sadly 4,252 people we have lost because of the post-COVID mucormycosis in India as of now. If you see the state-wise distribution, you will see that Andhra Pradesh has the highest 14%, Maharashtra 21%, Haryana 8%, Karnataka 9%, Rajasthan 9%, Uttar Pradesh 13%, Telangana 13%, Madhya Pradesh 13%. But this doesn't mean the other states don't have the fungus. Other states do have the fungus, but their percentages are low, so they should be careful. More surveys has to be done, more testings has to be done, more case reports has to be done, whether the mucormycosis cases are really less or they are getting not reported in the other states. So please, all the other states, I'm requesting, whenever you are finding anything of the next part of the video, when I will show you, when I will tell you, if you find any of the symptoms in your mouth, if you are a COVID recovered patient, please go to any health professional, maybe a dentist, maybe a doctor, maybe anyone. Just go and get it checked. It's very important, because mucormycosis is a very dangerous and a silent killer. The predisposing factors are uncontrolled diabetes mellitus, immunocompression by steroids, prolonged ICU stay, comorbidities post-transplant or malignancy, antifungal therapy, antiviral therapy. Coming to the mucormycosis, what you should do and which you should not do. Coming to the do's: control hyperglycemia, monitor blood glucose level post COVID-19 discharge and in diabetes, use steroid judiciously, use clear sterile water for humidifiers during oxygen therapy, use antibiotics and antifungal judiciously. What you should not do if you are getting to prevent the mucormycosis is don't miss warning signs and symptoms, which I am very particular about. If you have any symptoms, you are feeling anything in your oral cavity, please go and get it checked by a dentist or even by an MBBS doctor nearby, because it is very important. These are some of the cases. This is one of the case which was seen by Dr. Gururaj Arikari. He is one of my staff, and he has seen this case. There are 100 more of cases. I'm just showing you one. If you see this is just looks like this is some of the infection. This is what you will see. You will see bleeding from your gums, you will have swollen gums, you will have infection in your gums. If you're getting something like this after COVID, please get it checked by a dentist. If you see the x-ray, you will be able to see how the mucormycosis has destroyed the entire bone structure of your skull. So you will not be knowing, you will just be feeling there is a small gingival infection. It will get cured. You will do some indigenous methods, some home remedies, but please don't do it if you are a post-COVID patient. Get it checked by a dentist, get a CBCT or an x-ray done. It is very important. I am not making you feel afraid, but it is an alarming situation. better late than never. It's never late. Get it checked. Surgeries will be done, you will be cured. Better than when no time is left for you, when doctors have nothing to do. Doctors are human beings, they are not gods. They can do till you come to them in a proper time. You come at the very end stage, a late stage, where they cannot do anything. We also feel sorry as a doctor for you all. So please be sincere and come to the doctor on time. These are some of the references which I have referred for today's small lecture. Kindly want to go through. Thank you. I wish you people liked it. If you have any more queries about COVID-19, about oral health, about mucormycosis, you can message me in my YouTube comment section. Please comment how you liked it or you did not like it. Give me suggestions and don't forget to subscribe. Thank you. Please wait for some more videos. You will be getting a regular basis health related videos in this channel. Thank you.